Good evening, everyone. I would like to welcome you tonight to the National Fragile X Foundation Let's Talk webinar. Tonight it is Q&A with M&T, or as we like to say, question and answers by Mouse and Tracy, presented by our friends, also known as rock stars, Mouse and Tracy. I'm Jane Dixon-Weber, the Director of Education and Support Services here at the Foundation. Before I introduce our speakers tonight, I would like to first thank Warren Global Conferencing. They've made this webinar possible. A couple housekeeping issues. We are going to shake it up a bit tonight. Mouse and Tracy are just going to answer questions. Any questions that you have for them tonight. So use the chat box on the side for your questions, and also use that chat box if you have any problems. Now, I would like to introduce Tracy and Mouse. Mouse and Tracy are co-founders of Developmental FX in Denver, Colorado. Tracy Mernon Stackhouse is a pediatric occupational therapist, and she has a master's degree in developmental psychology. Tracy is involved in clinical treatment, research, mentoring, and training regarding OT intervention for persons with neurodevelopmental disorders, especially Fragile X syndrome and autism. Sarah Scharfenegger, fondly known as Mouse, has a master's degree from the University of Montana in speech pathology. She has worked in the fields of Fragile X syndrome and neurodevelopmental disorders for more than 25 years. They both worked at the Denver Fragile X Treatment and Research Center at the Children's Hospital in Denver, Colorado, and they both accompanied Dr. Rondi Hagerman to the UC Davis Mind Institute to initiate the program there, prior to opening Developmental FX here in Colorado. They've both written several book chapters and articles on intervention for Fragile X. They also consult and lecture nationally and internationally in Fragile X. Welcome, ladies. Thank you for joining us tonight.
Thank you, Jane.
Thanks, Jane.
We're glad to see so many of you guys out there, and we're ready to roll with questions. So, Jane, you're going to mediate this for us, right?
Right. How about, and you guys can also look to see, so I'm going to try to pick a variety of questions, variety of ages, variety of topics. So we'll try and get all of them tonight. Let's take the one, how about my son is almost 40, but still struggles in the transition of leaving the house, going outside, and getting in a vehicle for work or outings. Any suggestions?
Well, we have a lot of suggestions for that one. You know, when individuals with Fragile X exhibit so much anxiety, we see that played out in times of making transitions. And so leaving the house, which is an area of comfort, getting into the car, going places, can be pretty hard. And we have a variety of strategies that we would think about utilizing for this individual. But, you know, when you're 40 and you've been having a hard time with these transitions for such a long time, we sort of have to back up a little bit and not sort of jump into the strategies that we would do, like perhaps like a visual schedule, maybe a video model. Maybe there's some things in the OT arena or within the whole Fragile X arena that we need to work on in the home.
Yeah. So, you know, kind of what happens is you get nervous and you get kind of anxious, and having a brain that has, you know, is affected by Fragile X, it makes you really vulnerable to increased arousal during those times. And so a change kind of signals to the brain, uh-oh, things are unpredictable. Things are going to be shifting and changing and moving you out of comfort. And what the purpose of a lot of the routines-based strategies and the sensory-based strategies, the intention of that is to keep the brain in a state of comfort instead of discomfort. So transitions are going to be hard. Leaving the house, getting in the car can be hard. And if you signal too much, you know, start warning people way ahead of time, you're going to increase their arousal. But so you have to strike a balance here where what you want to do is kind of be really fair, giving them information, But the intention of your information and the intention of all the strategies is to put them in a state of comfort and a state of making the transition, the thing that's going to be happening to them, as predictable as possible and with access to things that are the most comforting. So we don't know your son who's 40, but this is a question that comes up all the time. And the idea is really to figure out for him what allows him to transport his sense of safety and comfort away from the home, what makes the world more predictable for him, and how do we organize time and schedules so that he can get back to his sense of safety and comfort or access it when he's out in the world. Usually when we hear these questions, it's because you have rhythms of the day that are going well, but then when you go to leave, like you have to go to the grocery store, or you have to go to a doctor appointment, we don't think about how do we take all the things that are working well and actually make those a part of the daily life outside of the comfort of home. So we kind of need to look at how are we going to back that up. Sometimes included in that is teaching him really active self-regulation tools. Some of those are sensory-based, things like deep respiration, giving himself comfort with pressure input, getting himself really calm, maybe with some rocking or linear movement before he leaves the house, doing things that helps him to be ready, to be in a state of readiness. So we like to teach people basic self-regulation, and that's to help him prepare himself, be ready for the transition, be able to predict and manage the transition in a predictable way, take the tools he needs with him that give him a sense of comfort, and also let him have permission to communicate to you what is it about the transition that's hard. So it just all gets cluttered up in the transition, and what we try to do in the strategies is to break it down so that you can think it through in a more systematic way and think about what have you done for him in terms of communication, sensory supports, self-regulation supports, routines and ways to make it more predictable. And when we put all of that together, it's going to make the transition easier. So that's like a shorthand answer to a really complicated set of things. And often we find families need to, even at the age of 40, it's okay to ask for help. It's okay to call up and, get an OT to come into the house and help you problem solve that, or find people that he feels really connected to that you can kind of help him to learn through them how these transitions don't always have to be hard, that they can actually be matter of fact and okay when all those supports are in place.
Yeah. In addition to what Tracy's just outlined, we don't want to surprise this 40-year-old by saying, okay, we're going to use a visual schedule for the first time, and it shows that here you are at the house, and now we're going to get into the car and go to the grocery store. That is not the sort of approach we would want to take. We would want to take advantage of that comfort in the home and introduce some of these sensory routines and language-based strategies in his comfort area where he's really calm. And then once he has an idea of, oh man, I can trust a visual schedule, I know I'll be okay, or I know a video model is giving me information so I can listen to it, then we can transfer those for more difficult transitions like getting in the car. We want to remind everyone that transitions are just so hard, and often when we are introducing a transition like let's get in the car, I want you to get into the car now, you're having a hard time, but get into the car now, we have to go. When all of that information, communication, and structure is focused on the individual with Fragile X, it really increases their anxiety. So it's very important to provide them perhaps not with that direct input of you need to get into the car now, but hey, we have a job. We have got to take this book over to your uncle's house. And, you know, you're your uncle's favorite nephew, so you're the one that has to take it. We've got to go. This is a job that's so important. And so being more indirect or providing a job for these individuals is another way of working with those types of transitions.
You know what I like about that is that what I found is that I think as kids become comfortable making those transitions, you know, for example, Ian knows now when he gets in a car, he's often taking, you know, depending on where they're going. I mean, he has friends now that he knows at Home Depot, thanks to he and Larry visiting there at least once a week. But he knows Kelsey, who works there, and he knows that she likes a Diet Coke, so he takes her a Diet Coke every time they go to Home Depot, because they just know when to work. So that's one of, you know, you find those transition strategies that work for your child, but that's something he instigated. You know, that's something that he did. That wasn't something that we thought of. He said, can I take Kelsey a Diet Coke? So I think that's a great idea.
Yeah, and you know, Jane, I think one of the beautiful things that you, in sharing stories about Ian, one of the things you've done all the way through his life is really honor who he is, what his interests are, what the things are that he notices, and he has a lot of social strengths like most of our folks that have Fragile X, and so he tunes into those things, and you honor that, and that honors him to be able to be who he is, and that's part of helping generally, so that's really cool, yeah.
And we have lots of cases of Diet Coke in our garage, too.
I bet.
Yeah, well, bring those to Dr. Riley. You know, she's a Diet Coke fiend.
I should know that. All right, my son is 17. He has always liked to touch his food with his fingers. It seems to be a very sensory thing for him. He's always done this, but does eat with utensils. For the last 4 or 5 months, it's become worse. Sometimes he'll eat his entire meal with his fingers. We encourage click to write.
We encourage, what was that?
Click to write. Oh.
We encourage click to write.
I see. Oh, it continues. To help him use the utensils, but it doesn't help much. I also made a visual schedule for him showing how to eat with good manners. This also does not help much, which is odd since visual schedules usually work with him. So he likes to eat with his hands, and I know lots of kids who like to do that. What would you suggest?
If I could interrupt really quickly, the click to write is just what's in the chat box, and it just stayed in whatever she was writing, so that has nothing to do with the question.
Okay, thanks, David.
I did see that it carried on. So David, can you hear us better now? David had asked us to talk louder. How's the volume now? I'll take it.
It sounds good. I'm responding for one of the people who had written in that they were suggesting that you guys speak a little bit louder.
Okay.
All right.
Right. So there's a few different things. I mean, one thing that's interesting, and I don't know the nuance of this, but in the question, you said that it's gotten worse lately. So one of the things that we know that happens just in general with kids with Fragile X is that during times of heightened arousal, and that can happen because school is starting, for instance, right now in the United States. So I don't know if you're here, but sometimes some skills that are emerging or new things that kids are doing get harder for them when there's lots of new stuff going on around them. So when we see variation in skill, a lot of times that's related back to arousal. So it sounds like using utensils initially is a new skill. So let me talk a little bit about the touching of food. There's a lot of different functions to touching food. The first thing is that lots of these kids have some sensory preferences around food, And when you have a sensory preference, your brain says to you, I need a little more information here. Is this safe or not? And one of the ways that you figure out safety is through exploration, through touching and feeling. So some kids touch their food first, or they smell their food first, because they need a little more information before it goes into your mouth. Your mouth is a place that's, it's internal. It's not on the outside of your body, and so you need a little bit more information. And lots of our kids who are more anxious and more prone to sensory defensiveness are going to have a tendency to want to touch or smell their food before they let it come into their mouth. So one reason can be because of that. The other reason that you touch your food is that to learn the skill of using your hands and using a utensil, you actually need more tactile input because it helps your hand to be more skillful. It's why when kids are in preschool, we have them crunching things up and playing in the sand and touching glue and finger painting, and all of that builds better hand skills so that they can finally use a crayon or finally use a pencil. So in increasing tactile input to the hands and the fingers helps your fingers to be more skillful, and using a fork or a spoon is a skill. So it could be that the skill is a little challenging and taxing because of motor planning problems. That's really common in kids with Fragile X. So it's really helpful to have an OT kind of come in and look and watch and see, is it more of that sensory kind of exploration issue, more of the I need more information around what is food coming into my body, or is it more my fingers need more information in order to be skillful? And then from there you can come up with an appropriate treatment plan to help support him so that utensils become just a natural part of his daily life.
Okay, thank you. And I can't really think of anything to add to that other than Ian tends to use his utensils for some things and eat with his hands on other things. And so the other thing I found is that, when I know that Ian could use a spoon, rather than saying stop eating with your hands, I would say, I would start with, don't forget to use your fork or use your spoon. Tell him what to do rather than what not to do.
Yeah, that's always important to be positive. And the other thing, this is really funny. I just remembered that sometimes the context matters. So we worked with this one guy who had a really hard time using utensils. And then they had a family wedding, and he had to dress up in like a tuxedo to go to the wedding, and then he kind of decided, like he got it. So these guys and girls, but people with Fragile X are Gestalt learners. They don't learn the little pieces of life sometimes very well. So using utensils is kind of like important to you and me, but if we haven't given them the Gestalt, the reason that that's important, sometimes it's not important to them. So this guy goes to the wedding, he's in a tuxedo, he sees everybody being fancy, and he uses his utensils at the wedding. So then the family, for about 3 or 4 weeks afterwards, they had all of their meals at the dining room table with the candles on, with flowers on the table, using the china. And then, the utensils were meaningful and they were important. And then it was like, oh, I've got it. I've got the gestalt of why utensils are important. And so that's a real Fragile X way of learning, is that you have to make it about the whole. You can't make it about the parts. And so that's also a really important thing to remember.
That's a great story, doing that at the wedding. I like that. Okay, here's a question about reading. Abe has started to really read. His teachers wonder about his photographic memory, but it's words like broccoli and mango, words we haven't worked on reading at home. He will demonstrate this by making a choice from a field of 10 novel words We want to make it more functional. What next steps would you suggest? And I did get a request for you guys to get closer to your microphone when you talk. So this is my microphone right here. So.
Okay. So, and David, can you just clarify for us, is the microphone the telephone or the computer?
It's your telephone.
Okay, so
All
is
right,
it better
good.
now that it's closer? Hopefully that's a little closer and better. Great.
Okay, can you repeat the question again, Jane, that this young man has a broad sight word vocabulary and
Like words like broccoli and mango, words that we haven't worked on, and he can pick those words from a field of 10 words, but we want to make it more functional. What next step would you suggest?
Well, you might want to associate some of the functional words that you would like him to learn with actual activities or the environment that's really contextual and important for him. So that's one of the first ways you're going to get him to sort of buy into the whole process by, getting an interest inventory of what all of his interest areas are and providing a lot of those sight words around that. And then you can start adding other words to those interest areas, but we need to get that sort of buy-in initially.
And it also is likely that you haven't taught him those words, but you go to the grocery store, you make recipes at home, he sees those with you in your daily life, and they become salient and meaningful because he's an incidental learner and he learns from the big picture and from the gestalt. And so, you're going to want to do two things. One is to continue to expose him to lots of visual information that includes the words, because he's picking that up. And then you want to start to back that into some phonics so that the reading that he is showing and interested in starts to be something where he can actually learn the process of decoding. So that's a little bit more of a next step, but because he's picking up on novel words, that's really that readiness sign that he's ready to start to back into that. So, broccoli is like the Broncos, go Denver Broncos, right? And so Broncos, broccoli, they're both BR words. Wow. So you start to work on, you don't want to do super traditional phonics or anything like that, but stick with what he knows, stick with what he's interested in, and you start to cluster and categorize the words based on where he sees them, like mangoes and broccoli are on menus, or in grocery stores, or on lists that you go and shop, or you talk to the chef about, or you watch,
or you find them in the recipe that mom and dad are using. Yeah.
And then you make and stick in those interest areas. So cluster them by interest, and then also cluster them by how they visually hang together, and then start to cluster them. And what we end up doing a lot is writing books based on the words that they know, and then building the words that we want them to know. So he's picking up on the words that are cool to him. Like he either loves broccoli or thinks it's funny, or you buy it a lot because you're really healthy, good for you, or whatever it is. But then maybe it's like Mr. Broccoli and Mr. Mango are going to go shop for cars, and or they're going to go to the hospital, and they're going to go on an adventure, and then they're going to start to take the words he knows into the things that he doesn't know and bridge it into the things that are working for him.
And that's actually very similar to what we did with Ian, is that we introduced words that were functional. And we also introduced like connecting words. So, and then we made books out of them. And now he's still in the process of backing into phonics, and so that is a kind of a long-term strategy to take. Okay, we have, and if you guys ever have any follow-up questions, you can email them to me. I'll give you my email at the end, and then I can always reach out to Mouse and Tracy too.
Great.
I've got one here. Okay. My son is 13 years old. Oh, can you hear me?
Yep.
Yeah.
Okay, it says they lost me, but okay, so I'm on the phone. All right, my son is 13, and he will hit himself in the face very hard every time he doesn't like what's going on around him. Trying to talk to him usually creates more aggression. Any recommendations?
This is big.
Yeah. Yeah.
Yeah.
Yeah. So, you know, the thing that's hard is that when you have the kind of terrible perfect storm of frustration around what's being asked of you, what you want to be able to do, how you can communicate that, and you have Fragile X and your brain gets really easily flooded, and then in that flood, now we're talking about hyperarousal, the more automatic kinds of behaviors tend to become more predominant. So he does this with lots of frequency. It's a way of communicating to you that he's frustrated, he's overwhelmed, he can't take what's going on, and he can't tell you in any other way, and he's really trapped. And so the first thing we want to do is back up and really realize that this is not a bad behavior. This is an attempt on his part to communicate. And what we need to do is get him feeling so much more comfortable and safe in his body and connected to the people near him so that he has other options to communicate. That we know that that's a hard thing to do, but it has to be, your goal is to shift the intention from putting a demand on him and expecting him to respond in a certain way, and then he can't do it, and then it produces this behavior. And he's practicing that really tricky pattern over and over and over again. And what we have to do is back all the way up to the very beginning of that cycle and realize that he needs to be in a safe state, an unaroused state, and in a connection with somebody he trusts that he can communicate with, and develop a different pattern around indicating to people no or stop or I'm not ready. So it comes back to communication and self-regulation, and it's not about compliance or continuing your agenda. We have to have self-regulation as the base, get him to communicate in a safe, connected manner, and then the behavior will really absolutely be not present. And we have seen this,
we've seen this many
million times.
Yeah.
So, yeah.
Yeah, and if you are able to make the environment safe, predictable, and consistent, that's just a beautiful beginning to working on those self-regulation and communication skills. Sometimes we see that this behavior happens more at school or it happens more at home. But we definitely need to get a good OT involved with this child, and if the behaviors are in the home, then we need to get someone in there to help the parents understand the behavior and working on this right now.
And the OT is going to work collaboratively with the other team members, especially around communication. And then you want to figure out, you know, is there certain times that his communication it really breaks down? Are there certain situations where his hyperarousal is really maximized? And then you can start to be more situational in approaching it. But the overall picture is that he is frustrated. His brain is driving the self-hitting, and you can't reinforce him out of that. The only way out of that is to back all the way up to the beginning and get him out of a state that is overwhelmed so that he has the potential to have a different behavioral response.
Okay. This is about a 7-year-old. He's in the 2nd grade. I get too close to my microphone. So he has had the same friend in his class for the past 2 years. She's nonverbal and easily cries when frustrated. Then Nate will cry when he sees her struggle, taking his focus away from lessons by his teacher. How do I help him navigate those emotions so they aren't so disruptive to him?
So the little girl is his best friend, and when she cries, he does the same thing.
He gets upset. Yes.
Gets upset.
Yeah.
Well, first of all, how cool that he's got a best friend in his classroom. That's a beautiful thing. And we know that individuals with Fragile X not only are strong imitators, but in this case, he has an enormous radar for emotion. And so when he finds that his best buddy is upset, it is upset to him in his core as well, most likely.
So so it's really hard because they kind of catch emotion from other people. But for all of us in the whole world, having Fragile X or not having Fragile X, negative emotion is a gift. It's a signal to you that you need to problem solve and find a way to connect back to your own kind of sense of who you are and your own purpose. So those are kind of big words, but basically the idea is, this little girl is distressed. He needs a way to acknowledge to her that she's distressed, offer her some comfort and solution, and also differentiate himself from her. So so what we do is we say, you're having a hard time, I'm going to offer you love and comfort, and I'm going to know that these grown-ups are helping you, and now my job is to go over here and do this other thing, and I can check back in with you if you're still upset later, or I can whatever. So it's really hard because they're in the same classroom, and her crying is going to be contagious to him. He's going to catch it and feel it. So this is going to be both setting up a communication routine, a really clear process for him, and helping him to understand about emotions in a kind of big way. He's old enough now, even though he has Fragile X, to really understand that when people are sad, other people take care of them, and the feeling doesn't stay forever. And so that is the kind of thing that he can learn through social stories, through video models, through, watching, movies and reading books about it with you and having that be really salient. And then he has to know that this little girl is being taken care of so that he can take care of his own job. And those are the kind of ways that you're going to differentiate for him. It is going to be hard because they are so imitative and they catch the feeling in such a big way. So the other thing that needs to happen is that people need to really figure out how to help this little girl to either recover, and so part of it is kind of what's going on for her as well. But yeah, kind of in general.
And we find often that people will use the term nonverbal when really, we would rather you use the term minimally verbal because, boy, that crying and empathy for her is communication. And so, yeah, he's minimally verbal. He's probably using some gestures, either that he's been taught or that he has created on his own. And for him to watch an adult provide comfort for this little girl with a lot of gesture and warmth might be something that we could video and that he could learn to imitate as a way of having something he could do with her or for her.
You know, it's interesting because I think that many parents will tell you that, you know, you can be in a grocery store and hear a baby cry, and bam, you know, your child will take off. And Ian used to walk up and go, "Is your baby going to be okay? Is your baby going to be okay?"
Yeah.
And so it's that, you know, there's that empathy that they do. It's like he's internalizing that almost, that crying, that I feel just as sad as she does. And,
True.
you know,
Absolutely right. And the thing is that, you know, in your day-to-day life, you know, part of living the Fragile X way, as we like to say, is that you don't want to wait for the moments where they're falling apart to do this kind of helping them learn. You have to do it kind of day to day. So if you're talking on the phone and your friend is upset, you want to share, you know, gosh, my friend was so upset, but that's what she's doing. I'm helping her to feel better, but it's not my feeling, it's her feeling. And you're just giving that kind of emotional education in your day-to-day existence. So if you are, you know, at the grocery store and the fishmonger picks up the fish and says, "My hands are cold," you can say, "His hands are cold and my hands are not cold." And you're just helping to point out the differentiation, because they are so overly empathic that if you go to now try to teach that lesson, now the baby's crying, you can say, "It's just like when I was talking to my friend. I comforted her, but then I know it's not my feeling." So it's really hard for them to differentiate that, and you
really
kind of have to help them learn that in your day-to-day life.
Mm-hmm.
That's really good, I mean, because it's really hard. You know,
It is really hard.
Yeah.
It is hard.
Every parent will tell you, you know, your child, you joke that, you know, my son can tell whether I'm in a good mood or a bad mood before I know whether I'm in a good mood or a bad mood. You know, then they
True,
go,
yeah.
Yeah.
So, I'm always in a good mood, so that's good. I mean, don't you think?
Oh, yeah. Oh, yeah. I've never seen you in a bad mood.
Okay, let's jump to an older young man for a little bit. Our son is 24 and seems to frequently have great difficulty transitioning to the dinner table without having negative behaviors to us by saying things such as, "You better be nice now." He does it just out of the blue when nothing is really going on other than final dinner preparations and getting the food on the table. He will also sometimes spell it out with his hands using sign language alphabet. I can sometimes prevent it by giving him a job as he comes in, like he's asking him to bring something to the table. So getting your child to come to the table without negative behaviors. Any strategies?
Well, I think this person's already solved their own difficulty. And if you live life the Fragile X way, you use that great knowledge that this mom or dad has by saying, "Wow, this transition to dinner time is hard." Now, Tracy always reminds us that the time of dinner is this rotten time of day when everybody's cortisol level is down. And that means that they're in a crappy mood and they're grumpy and
they have less coping resources. Resilience.
So we all come to the table at dinner time lacking some coping skills. But our friends with Fragile X have sometimes fewer coping skills. But yay to the mom or the dad that decided that having a job would be the way to get this individual to the table. And, you know, there's a million jobs around setting the table, and as soon as everybody's sitting down, maybe this individual could, you know, could pour some waters, and then, you know, if you guys say a little prayer, you could say a prayer or just say what, you know, what kind of a day you had, and then dive into eating. I love the comment that Jane started out with, "You better be nice," and you wonder where he's heard that.
You gotta wonder, where's that coming from? Oh, these imitators,
they're
going to reveal all the secrets.
They do, at the times you least want them to. So,
yeah.
But, you know, eating dinner, so tell me, there's got to be something about sitting at a dinner table that can be overstimulating for the kids. You know, you're this far from someone, and you know you're facing someone. You've got people surrounding. And so I've heard this from many parents, is that sitting at the dinner table is challenging.
Well, what do we do at the dinner table? We ask questions.
We have very close directed eye contact, and it's, you know, super intensively.
Tracy, what did you do at school today?
And it's the time where we're kind of doing that forced, you know, not always forced, but kind of catch up. So part of it is to remember that we need to make things a little bit softer in terms of the directness. So, you know, let's get a big centerpiece of flour so we don't have to like look right at each other. And, you know.
Yeah, and let's really practice on just making comments. Like I would say, oh, I had such a great day. I got to work early, and then, can you believe it? Someone brought me a bagel. I was so excited because someone brought me a bagel. And everybody can just make a comment, and then before you know it, the individual with Fragile X will say something.
Yeah, so sort of part of living the Fragile X way is everyone should have a tablecloth that says right on the middle of the table, make comments, don't ask questions.
Yeah.
And then it would be like a visual cue to everyone in the family to remember that we want to make this indirect and more casual and relaxed, so that there's less of that directed kind of input that makes them feel so anxious. The fastest way to shut a person down with Fragile X is to say to them, what'd you do today? How was your day? What are you doing? Where are you going? Where are you going this weekend? Like just any WH question.
Yeah.
It's done. Yeah. So you want to try to have dinner and not ask any questions. Super hard to do, but that's part of how you're going to make dinner not a threatening situation and a comfortable situation. Comfort's the key word. Yeah.
That's wonderful. That's that's really good strategy, I think, for all of us, because I think we're all, because we all have different formats, different ways we do it. So making it comfortable. Okay. Moving on. Do you have suggestions for teachers? Oops, my thing just rotated up. Do you have suggestions for teachers or parents on how to balance gearing schoolwork / therapy activities to the child with Fragile X interests and allowing them to guide or lead their learning activities without giving the child so much control that they never want to follow directions? So it sounds like, you know, how can you use the child's interests to guide the learning without letting them basically take control over, you know, what they want to learn and how they want to learn it?
Yeah. So, well, we have some different ideas about that. One of the things you want to do is realize that on balance across the course of like a school day, so let's, this is a school situation. So in the school day, it really helps to take the daily schedule and say, how does the schedule match to goals? And how can we try to say, we want to work on some number concepts. Where's the best time of the day to work on number concepts? It may be during math class, but it could also be during,
social studies.
Yeah, where
dinosaurs,
you're counting the dinosaurs or looking at, the number of rivers that happen to be on that map or something like that. So you want to figure out first kind of what are the goals, and are those goals appropriate, and then how are they going to match onto the day. And then we find that infusing the interest into the materials instead of having the interest drive everything allows you to sort of turn that coin around so that the interests are infused into the goals and the schedule, not that the interests drive everything, because that's much more the way that all of us need to be as adults in the world anyway.
Yeah, that's a nice differentiation. Yeah.
So I think that's just in general the answer. Yeah.
All right. Hello. Recently, my son Jacob started chewing on his nails. He completely started chewing them off. He's 13 years old.
Oh,
Oh,
13.
hello, adolescent anxiety.
Yeah, there we go. Welcome to the world of adolescence. That's it in a nutshell.
Yeah, so
No, but honestly.
increased anxiety in adolescence is really common, even in anybody. And so he's just showing you, you know, the thing is that chewing your nails, if you go to pretty much any, you know, 7th grade classroom, half the kids are going to be chewing their nails. So it's really just a pretty typical biologically driven behavior. You want to get more input into your oral area, because especially when we do things at the front of our mouths, where we're touching our lips and getting a little pressure into our front teeth, that's really calming and organizing. And so your hand is there, your nails are there, it's easy to do, and it's just a pretty typical behavior. I used to be a nail biter for a long time. I was a nail biter. My brother was a nail biter. He used to chew his nails down to the quick. It's a pretty typical thing that you're going to run into. So part of it is to just sort of back up and say, what kind of supports do we have in place to manage his anxiety? And we don't want the anxiety to get out of control, because when it gets out of control, we always want to remember that as anxiety and hyperarousal turn up, learning turns down. His attempt to cope is showing you adaptation. It's showing you a positive thing. He realizes on some level he's stressed, and he's trying to do something about it. That's a beautiful thing. What we need to do is tap into that and help him to do it in a way that's the most productive, the most efficient, and so that, you know, and if nail biting isn't the best choice, then we want to give him some other choices that are as effective.
And do you have any suggestions for other choices? Like gum chewing?
No.
I don't know if it's appropriate or not. I mean,
you know, so here's the thing. What we've learned in the whole field of sensory integration is that we don't want to chase the symptom directly. In other words, if it's nail biting in and of itself isn't necessarily, like, we don't need to chase the nail thing, and we don't necessarily need to even chase the oral thing. We might. So sometimes people are really quick to give an oral strategy, like a chewy or something like that. But what he's really wanting is something that's quick, efficient, and available to calm down his nervous system. So what we would want to do, and there's, you know, books written on this topic. So there's lots of strategies. You know, like any of the zones of regulation, the alert program, the how does your engine roll, those are full of strategies. But what's really important is that this child have an opportunity to work one-on-one with a therapist who both understands him and the strategies and helps him to really own the strategies so that he'll actually use it. Because what happens for these kids is that people throw sensory strategies at them, but nobody actually helps them to get it, to really own it. And then they don't really use it, and they're going to use the thing that they've inclined to. So they're going to chew their nails or hit their head, like we heard earlier, or they're going to pick their skin. That's another really common Fragile X behavior. And so instead of chasing the symptom, what we want to do is treat the underlying issue, which is the anxiety, and that's only going to be done in the context of a good relationship with a therapist who has lots of tools and helps the kid to really get it. And then they really can own the strategy, and they'll be able to weather the stress. And that's really what we want, because living with Fragile X is living with stress. It's part of having the condition.
I got you. Thank you. That's a good explanation. Okay, this one is from earlier that I missed. When you are dealing with the 5-point scale, What are good strategies when kids are on 4 or 5, especially 4? Sensory strategies, etc. Now,
Yeah.
do you know the 5?
Almost the same answer.
Yeah, well, so it's the incredible 5-point scale. We use them all the time, and what we want to do is have kids start to learn and notice. You know, a 1 and a 2 is really calm and in the just right state, and then they start to escalate up. And if they get too high, then those are really red alert states that are not very safe or comfortable to be in, and they can produce lots of challenges. So yeah, we want to keep kids, you know, in 3s, noticing and shift them back to 2s and 1s before they get to a 4 or 5. But if they get there, the thing we know that you have to do is you need to stop your demands. You need to absolutely 100% drop your eye contact. You probably need to get closer to the ground and be more grounded with them. You need to offer lots of safety and comfort and get them getting into a deep connected breath and slow their nervous system down. We don't want to be firing off strategies. We want to practice these things when they're not in a state 4 or 5 so that when it happens to them, it's not novel and unexpected, so that they know this is what I do to calm myself down and here's how I get back to my center. So that process of getting back to center is going to be different for every individual. It needs to be a part. It's like kids who have really bad seizures. Everyone in their world learns what to do when the kid has a big seizure. They stop, they drop, they keep them safe, and they get them back to a baseline. In a way, hyperarousal is like that for people with Fragile X. We have to sort of, everyone on the team needs to know, we need to just get them back to baseline. And so what that looks like is going to be really different for every kid, but dropping your demands, making your voice more compassionate and rhythmic, softening your eye contact, offering a really neutral breath yourself that's strong and calming, and then helping them to access their calming tools. And really, as many people as there are on the call, there's going to be that many strategies, right? So it's really individual. But what we don't want to do, what would be great is for every person with Fragile X to know what their calming toolkit is. What works for them? And if you don't know that for your child yet, then that has to become an intervention target and a school target. We need to know how to get them into a calm, organized state. And when you know what their formula is to getting into that calm state, then when it happens, they know what to do, you know what to do, and it all rolls much better.
Now, Tracy, if an individual is working on the 5-point scale, don't you think that the finding out what tools you're going to have for calming and organizing are going to be a process of discovering that with the clinician?
Yeah.
I mean, it's going to be a process of talking about what makes me feel good, what makes me feel centered, and then trying to build those into something that makes sense for that individual, for a tool for them for when they're out of 4 and out of 5.
Absolutely.
That's what, I mean, to go along with that, we discovered that Ian liked to swing, and so we have swings everywhere. And so
That's right.
He automatically seeks those out. We have them in we have a rocking chair in the house, we have a swing in the front and a swing in the back. And so, and that's where he heads when he does it, you know, and you'll find, as you discover these things, the kids will seek them out themselves. They know what they find calming.
Yeah,
that's
absolutely.
right. Yep.
We're going to hear just a tiny bit. My son likes to take his pants off. We try to tell him it's not appropriate, but I don't think he gets it. Any ideas?
Where does he, well, I guess we don't know where he takes them off, but, maybe when it's, he comes home from school and he's had it with the day, and the same way dads come home and rip off their tie and moms throw off their pantyhose if they're still wearing them. They need to seek this level of comfort at the end of the day. Also, you know, we've time and time again worked with kids who are taking their pants off in school. It's, again, trying to seek this level of comfort when in this really hyper-aroused state. And, of course, some of it can be related to some sensory defensiveness that is exacerbated by anxiety and hyperarousal.
Yeah, and it's also, you know, as your nervous system gets more aroused, more parts of your nervous system get aroused. And when you start to get autonomic nervous system arousal, you start to lose your temperature regulation. It's also going to be true when there's different parts of the day where their stress chemistry is less available to them. So when those cortisol levels deplete out, and people with Fragile X have different levels of those stress hormones available to them anyway. And so what we want to do is realize that sometimes this is really biological. And if your autonomic nervous system starts to get really dysregulated, it's going to make temperature processing really different. So one of the things, the really common things that we see with this is physiological flushing, kind of reddening of the face. You're going to sometimes hand flapping is because they're hot and their hands are sweating and their palms are sweaty because of too much activity in the sympathetic nervous system, and they're trying to kind of calm that down. They're going to seek out the floor. Sometimes they want to lay on the cold tile. Sometimes they'll take their pants off. Sometimes they take off all of their clothes. They're going to have more distress in their stomachs, and so sometimes they take their pants off because the tightness and the restriction around their tummies is really hard for them to manage. Sometimes they're going to have bowel and bladder issues around those same issues. They're going to, you know, really be in a state of distress. So what we need to do is back up, talk with your team, your physician, the psychologist, the OT, really get a good plan in place, often the speech therapist as well, because all of this is a breakdown in too much arousal in the system, and then their system needs a lot of support to calm down. So it's really less about the pants and a lot more about the arousal problems. And so we want to treat it based on that antecedent, and that's the biology of this. Okay.
Okay. Here's an interesting one that just came in, and I think this applies to a lot of families, and so I want to read it. I've recently learned that as our kids become adults, anxiety becomes a bigger issue versus ADHD. My son had been on medicine for attention since preschool. I finally had the nerve to, with doctor support, take him off his Adderall and increase his Zoloft. It seems to have helped.
Yeah, you know, we see this sort of developmental progression where at different times the attention issues are more prominent, and at different times the anxiety issues are more prominent. We often see that the anxiety gets worse in those teenage years. It usually gets worse at age 3 or 4, and then it kind of gets to a certain level, and then it sort of often gets worse again at you know, teenage years, and then it can kind of get worse during those adult transitions. And then it does seem to kind of soften out often later, but then it seems to come back again. And we'll see 40-year-olds who are starting to get reclusive and not being able to participate. And so there's definitely, you know, not a well-defined, there isn't great research around this, but we do know that it kind of waxes and wanes. So the story is that you have to stay really in touch with a multidisciplinary team to help keep track of what's the current presentation. and the medications and the other therapies are always going to need to match kind of where is the person at right now. It's never static. It's never steady. You know, things get more stable, but there's going to be variation across the lifespan. And so you want to, you know, be checking in and getting support and having things reevaluated. So it's really good that you went and had the medication shift to match the symptom presentation.
Often as adults move away from high school, services tend to be sort of minimized as they approach that, I'm leaving high school and moving into a different setting. And we see that any kind of support or a therapy tends to be eliminated from the individual's life, and especially at a time when there's a huge transition. And if any of you parents have visited a typical work site where it's a large warehouse and it's very noisy where individuals are working, or they're in a day program that's just congested with other adults, and it's kind of unpredictable about what's happening, and there's no go-between person to provide supports for the individual with Fragile X in these new experiences that they're having. And it's so important to remember that these supports need to be put into place whether your child is 4 or your child is 44.
I think that's a really important aspect that we all need to remember is, you know, you remember, and you guys even talked about it. Oh, you know, you set up a picture schedule or a visual schedule and the child does it, and then they take it away because they know how to do it. And so that's a good example. Another question, and then we'll have to check your schedule to see where you guys are thinking how long you want to go. I had one here that was a little bit different. Okay, our son loves to slam doors and seems to like the low frequency sounds it produces. He's turning 5 in November. Any advice?
So it's pretty typical for these kids to find certain little things that they can kind of get stuck on. Sometimes that being stuck on it can have a sensory reason like that. Like I love that sound, that percussive, deep vibration just feels so settling and organizing to me, and it makes me feel connected. And so what that's telling you is the kind of, this is the quality of sensation that helps him to feel centered in his own body. And when kids see something that makes them feel good, it's like me. I see, you know, a nice glass of Sauvignon Blanc, and I'm going to want to have a drink of it. So, I mean, it's like, you know, I see a fidget toy. I have one in my hand right now, and I need something. So and doors are everywhere. So we see lots of kids who find certain things that are really common in the environment, and they can become a little bit of like an obsessive kind of, I must do that kind of behavior.
I must do that, yeah.
But again, what we're doing is trying to look at what is it that does for them. And often, if we can sort that out, it's the window into understanding their nervous system. It's the window into understanding what makes them feel that sense of comfort and safety and connection. And in the end, that's what we're all looking for, is kind of comfort, safety, connection. So, you know, deep vibratory percussive input is something that you get when you feel your nice, slow heartbeat. So often when I see kids that are seeking that deep percussive input, you feel their heart, and their heart is racing. It's the opposite of and they're seeking that thing that they need. Those same kids often really respond beautifully to their fathers because dads talk in lower, quieter, more percussive voices. And so we want to try to figure out if that's the quality, how to enhance that as a part of his regulation routine. If he feels regulated and can access that kind of input, he won't need to do it every time he sees the door. So it's kind of using, and this is really a discussion that you would want to have with your OT. There are also some more specialized kind of fancy interventions that OTs and sometimes other clinicians have to look, sometimes music therapists, to kind of look at how can we provide that quality of sensation that he's seeking in a way that's super proactive and more in a front-loading kind of way instead of waiting for him to see the door and then do it. So it's really a problem-solving process, but kind of honoring what is the quality that he needs, and that's going to help to solve that issue for him.
That's like slamming a door. Makes me good. That's what makes me think that. What do you do when visual supports aren't improving the hitting, kicking, and biting my son does to me when he gets anxious in some social settings? What else can I do?
Well, we think about the supports that we put in place, like the visual supports, visual schedule, things like the language-based supports, like, you know, a social story or a video model, and we think also about these sensory-based supports. And sometimes we think of them in sort of a hierarchy, and which one is going to have the most power for your child. And if you've got some pretty aggressive behavior like that going on with a parent, probably a visual schedule is not going to be a heavy hitter enough to shift that behavior. So we need to take a really long look at, as Tracy says, we have to back way up and how are we working with hyperarousal and anxiety? What else, Tracy? How are we?
It's also that those three, we kind of try to categorize these interventions because there's so many of them, but we want to kind of look at those language-based, routines-based, sensory-based interventions in a hierarchy, but also as a concert.
Yeah.
It's not any one thing that is going to help to support. It's going to be the whole concert that's going on around them that helps them to feel grounded and safe and centered so that the anxiety and the hyperarousal don't take over. And when you're in a hyperaroused state, you're more primitive. You're going to act in primitive ways, and that often includes aggression.
And it often includes aggression at someone who it feels safe to aggress towards.
And the function of that aggression is communication. It's, I'm feeling overwhelmed here. I'm feeling out of control. I'm feeling like I can't manage what's happening to me. And it's basically a call for help. And so you need to back up and say, oh, I'm going to help you to not be hyper-aroused, but that's not one thing. A visual schedule in and of itself, if you're already hyper-aroused, it's just contributing. It actually is like a demand, and then it's just making the arousal worse. And so you bring the schedule out, and then he hits you. So you realize there that you need to back up and get his arousal state more, minimized, and he needs to trust that the visuals are there for the purpose of supporting him and not for the purpose of making his life miserable.
Yeah, and also, when you think about, this seems to frequently happen in social situations. Think about what happens in a social interaction. There are a lot of demands, and there are a lot of direct demands to look at a person and to respond to questions, which an individual, especially with Fragile X, comes to this world having a hard time with, but in a social situation, those are really exacerbated. And then to add on to that, if you know, we really need to look at what are the aspects of these social situations that are increasing that anxiety, and are there some skills we need to teach here? Is this individual also becoming aggressive because they are lacking any kind of a skill to be in a social interaction? And so that's another area that we have to look at.
It's a real challenge. I mean, because sometimes you get yourself into a situation and it escalates before you...
Before you even know it.
Mm-hmm.
Yeah.
It's a real challenge. All right, we've gotten about 3 or 4 questions on perseveration. Let me throw a couple at you. Could you address perseveration? My adult son will make the same comments over and over and over. I agree. My 2 Fragile X adult kids do the same thing. Perseverate, perseverate. We'd like some suggestions on how to decrease the perseveration.
First of all, you have to love the perseveration.
Right. You got to love perseveration. It can be pretty darn fun sometimes.
Yes,
it is such a common part of Fragile X, and we know that perseveration comes from that inability to being over anxious and being overwhelmed. And when that happens, you know, your ability to access really great language deteriorates. And so you may repeat the same question over and over again. You may be reminding your mother over and over again about your favorite weather program is coming on soon. When is it time to see that? Is the weather program on soon? There are all kinds of comments or things that individuals can perseverate on. And it does always seem to come from an area of anxiety, and often it's because these individuals don't have enough information available to them. And that's why sometimes having a visual schedule where you can say, oh, I know you're really interested in watching your favorite weather program. Let's take a look at the schedule and see when it's going to be on. Or let's take a look at the schedule and see all the things that we need to do before the weather program comes on.
So, and it's, you know, even when the person is the least anxious, the baseline of anxiety makes it so that, you know, but there's other characteristics that make perseveration present as well. So they have a harder time kind of coming up with new ideas.
Yeah.
They have a harder time kind of putting together a range of different experiences that would help them to be able to talk to you about something different. So part of it is also sort of this skill deficit around communication and trying to help them shift into other topics is really about kind of, you know, just exposing them to rich experiences, you know, and sharing and joining in with them. So sometimes when they start perseverating, you need to join into the topic and then from there join them and expand out instead of rejecting their topic, because then that starts to make them feel like more out of control, and then they have to retreat back to the more familiar. So sometimes the you know, really listening to what is it that they're perseverating about. Are they perseverating about time? Are they perseverating about a worry? Are they perseverating about an interest area? So really listening to them and honoring their voice and what they're trying to talk to you about, and then meeting them there and helping them to naturally build language in more areas or around the function that they're trying to talk to you about is also really important.
Yeah.
Well, and if I can just expand on it just a little bit, then this one mom says, my son will watch scenes in videos over and over again. and he'll rewind it and watch it, rewind and watch it. It's almost calming to him. Should I let him do this, or is there something else I should be doing?
So, that's one calming skill. What would be a really cool gift is if every person with Fragile X had 10 or 15 really tangible calming skills. Many of them have one or two, but even for yourselves, just stop for a second and think, like, what do you do when you're feeling anxious? What do you do when you're feeling stressed? Most of us only have a handful. And to be really healthy, robust adults, we all need 10 or 20 good, solid coping skills. So you don't ever want to take away something until you've given additional options, because otherwise that's just punishment, and that's mean. We want to, so that is a thing that a lot of these individuals get into. It's like, I love it. I love to watch, Donald Duck fall off that bridge, and I'm going to watch it over and over and over again. Or I'm going to watch SpongeBob, eat all the Krabby Patties or whatever it is. So I get stuck on that one thing, and I think it's hilarious. Again, it's kind of cool to join in that and say, yeah, let's go make Krabby Patties. Let's do it ourselves, and give them an option to take that into their life instead of it being a restriction in their life. You really want to see what is it that they're doing. So if it's calming them, great. And they're going to go to it because it's passive and it's readily accessible. It's just like chewing your fingernails. They're right there, and I can access them. Does he have access to 10 or 15 other calming things? Then he'll make choices. If he doesn't have choices, he won't make choices, and he'll keep doing the same thing.
That's a good point, because George on the call has made the suggestion that, we'll, on our Facebook page, we'll post that. What are some calming things for you to share ideas, and so that we can start building our repertoire. And George, if you want to send me a friend request on Facebook, sure you get added to the Fragile X group. So ladies, we are at 7:18. There's still a couple more questions. Do you want to stay? You want me to have them emailed to me? How would you like to handle this so that we're getting, let me find one more. I've got one more long.
One more question, and then we'll wrap it up, and then the rest of them, you can send things to Jane, send them to the Fragile X website.
Yeah, Jane always sends us the questions.
She brokers them to us, and it's so cool to see so many familiar names on this list. We love this Fragile X community so much, and we just, seeing your names out there, it's just like kind of heartwarming. It's like a little family reunion right on the webinar.
It really is.
So hi, everyone.
Hi, everyone. We know who you are.
You guys are so funny. Okay, my son is 3 years old, and they just ran. Okay, and I'm working through the hyperarousal issues, primarily throwing objects at people. The interesting thing is that the throwing will occur after he is happy. Sorry, my comments keep spinning. He's built a tower of blocks, for example, and then instantly transitions into what appears an anger response, which is throwing. My response is to firmly say no. Jump around like this.
Okay. Boy, this sounds like
it's like the whole perfect little thing.
Yeah. There's a little boy we see here, and we have a great relationship, and I always go out in the waiting room and play with him, and he gets really excited, and he starts throwing blocks. And why does he throw blocks? Because he's throwing blocks because he's hyper-aroused, and he's really positive and happy and excited, and then when that happens, his skills deteriorate, and he can't remember what else he can do with blocks or how he can use blocks for another function. We actually then worked on kind of shaping his use of blocks when he sees me by always putting them in this really fun bucket that he likes. Individuals with Fragile X have these motor planning problems where it's so hard for them to come up with an idea of what to do with something. Like any of us here in the audience could come up with, Tracy, 5 things you can do with a block. Oh yeah, you can wear it as a hat, you can stack it, you can drive it like a car, you can pretend like it's a telephone, you can use it
Eat
as
it,
a
you can
football.
eat it.
You can eat it.
Yeah,
You can,
okay, there's 5. So, but, you know, the most primitive and obvious thing you do with a block when you don't have any other skills is to throw it. So, you know, here we could be looking at hyperarousal and inability to access skills that have already developed, or the lack of skill that hasn't developed yet and really, really needs to be worked on. And that's just a part of the answer. Yeah, absolutely. So, you know, it's really common to see the most primitive behavior in a state of hyperarousal, or when skills are hard to access, or when skills haven't yet been acquired. So what we need to do is back up and say, okay, block throwing, is that communication? Is that I don't know what else to do? Is that help me, get me into a safer state? So we want to respond based on kind of what does it mean? And that's how he'll be able to associate that with, aha, this is what I'm supposed to do. So it takes some practice, and you're going to need
The guidance of a team.
the guidance of a team to sort it out, because it's not always, you know, sometimes being mad is frustration, and frustration can come from multiple sources. So, yeah.
Yeah.
Okay. I think we should call it quits for tonight, and I want anyone to know that they can send me an email, treatment@fragile.
We've got a glass of wine to give you a toast. Toast, cheers.
Thank you, everybody out there. Thank you, Jane and David.
We love
Cheers.
you. Mwah.
You guys are too funny. You're just too funny. Here, drink. So yes. So David has posted my email on the list there, treatment@fragilex.org. Send me your questions, and I can forward those on to Mouse and Tracy. It was a great evening. So let me just finish up here and give all my thanks. Thank you. I've got Mouse and Tracy for sharing your expertise with us. You have a wealth of information. I mean, I think we could probably talk all night.
All night and all day.
We should do these more often, guys. We'll do these more often. This is really fun for us.
All right, David, I can. Let's take them up on that. Well, you know, to your point, in our next Let's Talk webinar series, we have Dr. Craig Erickson coming back for the 3rd time to talk.
Woohoo!
He's
so
great.
We love Craig.
Yeah.
So he'll be here Thursday, October 8th. So mark your calendars now. We will be sending out email announcements, and I would like to, again, thank Warren Global Conferencing, thank Mouse and Tracy, and thank you all for joining us tonight. What a great conversation. Send me your email. Let's stay in touch, and let's don't stop now. This is too much fun.
Okay.
All right, thank you, ladies.
All right.
Bye. Bye.